Good afternoon, sir. My name is RGC Caballero, and today we're gonna perform assessing the thorax count. So first things first. You need to identify the patient and of course introduce yourself. So hi, sir. Good afternoon. My name is RGC Caballero, and I am the nurse for today. And can I ask for your name and birthday?
My name is Miguel Andrews Timorban, and my birthday is May 16, 2007.
So after identifying the patient, next step you need to do is to explain the purpose of this assessment. So sir, the purpose of this assessment is to check all your respiratory system, if there are any sign of abnormalities that can lead to your future diseases. Then, if you have any questions, sir, you can ask questions for now. So after explaining the purpose of your assessment, next thing you need to do is to perform a hand hygiene. Then after performing a hand hygiene, assist the patient to undress and provide some patient gown. So as you can see, for assisting, as you can see, the patient is all good. So conscious of for the gown. So after we're gonna proceed to the assessing the thorax and the lungs for posterior. So first is you need to inspect the posterior thorax, examine the bone, examine the skin, the bone, examine the bone, the skin, the symmetry of symmetry of expansion of the lungs, of the thorax, of the lungs. So, sir, can you brief me? As you can see, it is normal. Then after inspecting the posterior thorax, next you need to do is to assess the antero-posterior and lateral diameters of the thorax. So first, we need to ask the patient to arms forward to check the antero-posterior and the lateral diameter. So after assessing the antero, posterior, and lateral, next thing you need to do is to palpate over the spine and posterior thorax. First is you need to use your palmar hands to assess the temperature, the tenderness, and the muscle accessory of the patient. But for assessing the temperature, you need to use your backhand, because this is the accurate for palpating the temperature. So after assessing for the temperature, next thing you need to do is to assess the tactile firmitudes of the patient. Ask the patient to take a deep breath and ask the patient to say 99. But by using the ball of your hand,
Wait,
This
say 99, 99, 99, 99, 99.
okay. After assessing for tactile firmitudes, next thing you need to do is to assess the thoracic expansion by standing behind the patient and sir, can you stand? Sir, can you do this and put a back? Yeah, so this is the technique that used to locate the T9 or T10, and by assessing for the expansion of fan, use your thumb, both thumb. Sir, can you breathe in, breathe out? So this is to check for the expansion of the symmetry. Next is to auscultate the sorry. Next is to percuss over the posterior and lateral lung by using the zigzag pattern.
So next, then assess the anterior posterior thorax and anterior posterior thorax and lateral diameters of the heart. So now, placing on the so last, we're going to palpate over the spine.
So after percussing the posterior thorax of the patient, next thing you need to do is to auscultate by using the stethoscope. So the same pattern, zigzag. Sir, can That is the last step for ausculting, or for the posterior thorax and lungs. Next thing is we're gonna assess the anterior thorax and lungs. So this is the same procedure. First step is to examine the anterior thorax, same as the posterior. Okay. Next is we're gonna palpate for tactile firmitudes. And for tactile firmitudes by using the ball of your hand and ask the